Hi, I'm Dr. Jacob Teitelbaum, and today we're going to talk about natural treatments for carpal tunnel syndrome. Do you wake up in the middle of the night with your hands numb and painful, feeling like you have to shake them out? Do you find that you have pain in your hands and numbness and tingling, especially if you're holding them in funny positions? You may have carpal tunnel syndrome. What that is when the nerve that goes through what's called the carpal tunnel in your wrist, the median nerve, gets pinched because of swelling in that tight tunnel. That causes the fingers to go numb, and especially at nighttime when the hand gets in funny positions and the nerve gets stretched, you'll wake up with numbness and tingling and the feeling like you have to shake out your hands. A simple way to tell is to put your hands together in a prayer position. And if you hold it like that for 60 seconds and it makes your hands numb or start to ache, you have carpal tunnel syndrome. Your doctor will usually tell you to go ahead and do surgery. You don't need to do that in most cases. We have treated many people with carpal tunnel syndrome over the last 30 years, and I've only had to send one person for surgery, and that was a person who had continuing repetitive stress injury at work and could not give up that work. Here's how you treat it. You treat it by shrinking the swelling in the tunnel, and you can do that very easily by taking vitamin B6, that's pyridoxine, 250 milligrams a day. After 6 weeks, most of you will find that the carpal tunnel syndrome symptoms are decreasing significantly. Also dramatically effective for decreasing swelling would be thyroid hormone. And even if your blood tests are normal, in my patients I will give a treatment trial of natural Armour thyroid by prescription to anybody with carpal tunnel syndrome, because carpal tunnel syndrome may be a manifestation of underactive thyroid, again, even if the tests are normal. Third, you want to go ahead and wear a wrist splint at night. It's called the cock-up wrist splint, and it keeps your hand in a neutral position as if you're holding a glass of water. It keeps your hand from getting into funny positions while you're sleeping, taking the strain off the nerve so it can heal. Last but not least, if you have repetitive stress injury at work, or the work seems to be aggravating the carpal tunnel syndrome, see if you can either change jobs or do a different position so you don't have as much repetitive strain, or at least wear the wrist splint during the day to help protect the nerve. If you do these things, most of you, almost all, will find that you can cure your carpal tunnel syndrome without surgery. This is Dr. Jacob Teitelbaum wishing you great health.